Who gets the money? That's the type of lack of transparency that is absolutely unacceptable in this country. And, it's interesting. I always wondered when, before I came here to this place 3 years ago, people would talk about boards and people getting appointed to boards, and you think, wow, they don't get paid much. How do they make money? And now you understand how, under this NDP Liberal government, how they've done that. And what they have done is to pad the pockets of companies that they control.
Recently, our freedom-loving Rebel Live conference went off without a hitch in Calgary. It was a lot of fun and really refreshing to hear from great speakers as they bounced off ideas and perspectives about how to improve our great nation, including how to fix some of the damage that's been caused to it from radical ideologies and agendas at play. One of those speakers was medical doctor Stephen Ellis, who previously served our country well with the Canadian Armed Forces and now serves as a Conservative MP who is also Canada's Shadow Minister of Health. Dr. Ellis gave an important and timely talk about what he calls Canada's safe supply foolishness.
47,000 Canadians have died due to drug overdose. 47,000. And when you think about all of those souls, one of the things that I often think about is none of those folks were born and as they grew started to say, I wish that I could be a drug addict when I grew up. None of them ever thought that. Little Sally or little Johnny always had a dream. And as Alexandre mentioned, I was a family doctor for a very, very long time and had the opportunity to see children, grow from birth all the way into their adulthood. And some of them have done very well, some of them not so well. But I know that none of them ever came into my office and said, I wish I could grow up to be addicted to drugs.
You can catch that in full as well as some of the other discussions while we roll them out and support our journalism by subscribing to our exclusive content at rebelnewsplus.com. But for now, I wanted to show you a quick interview I had with Dr. Ellis after his talk about what, if anything, would be different for Canadians under a Conservative government when it comes to transparency in public health, as the people slowly are recovering from years of government overreach fueled by COVID hysteria. You're getting a lot of momentum in your party. I guess the first question is, what can Canadians expect under the Conservative government if you are to form government? What would be the first course of action when it comes to public health?
That's interesting. I was going to tell you that we're going to axe the tax, build the houses, fix the budget, and stop the crime. Those are certainly the four things that we're absolutely seized with. From a healthcare perspective, one of the things that we've come to know very easily is there's 6.5 million Canadians who don't have access to primary care. And when we begin to understand that, the system in Canada is really predicated on the fact that through a family doctor is how you access everything, whether it be lab services, x-ray services, or if you need them, specialist services. And when Canadians don't have that access, then regardless of what people want to think about a system, if you don't have access to a system, it's an absolutely terrible system. So we have a program called the Blue Seal program. We know that there are probably at least 20,000 internationally trained physicians here in this country who can't practice because of the difficulties accessing through the regulators. And what we will do, and we've worked very hard on this the last 2 years, is to allow people to have a practice-ready assessment program so that you're able then to very clearly demonstrate the knowledge and skills that you've gained in your country of origin, and then, of course, be able to work and serve Canadians. So it's a win on both sides in the sense that not only does someone get to practice their profession here, but they get to serve Canadians, which is incredibly important. So you will see that come out as the Blue Seal program in our platform.
Before 2020, it was common for most Canadians to not even know their public health officials' names. And then we saw those names be household names. There were orders given that many Canadians believe were coercive in nature and divisive. So how is your party going to rectify that? What would they do to rebuild trust in public health?
I think the main things are looking at what Premier Smith said earlier this morning. That's really inside the purview of what provincial governments will do as a response to public health emergencies.
During COVID, I know that there were a lot of private individuals from private companies who also lost their jobs, but it was government who set the stage. It was government who was enforcing that. And so we've then said, government's not going to do that in the future. We're going to respect rights. Anything that we do has to be done through that lens. And I hope that will have an impact on how private sector operators enact their policies. And if it doesn't, if we have to do more, then we can do more. But I think it's an important first step, and we'll see. What we're hoping to do is send a signal to the court that these things matter, that if we end up in a dispute, that they've got to consider whether or not government was reasonable and whether or not government put a lens on it of protecting individual rights.
And we know that that part of what we've talked about as Canada's Conservatives is that message of freedom and freedom of choice, and that's incredibly important to us.
What if governments are trying to reinvent the wheel when the greatest teacher of all times has already laid out the perfect blueprint for a constitution for a kingdom of love, faith, and freedom? Introducing the Kingdom of Heaven Freedom Passport. This special edition Freedom Passport captures the foundational truths of love, ethics, and freedom for all. It's a powerful reminder of Jesus' call to love one another and to be part of something bigger that you can carry with you every day. Join the movement, share the truth, and spread the love with your family and friends. Get your Kingdom of Heaven Freedom Passport at freedompassport.ca. And right now, all orders in North America come with free shipping and a free downloadable song with every purchase. Well, we did see changes made in the name of health federally, for example, with not being able to fly, mobility rights, and things like that. So is there anything that you want to comment about in that area?
I think when we begin to reflect on those things, you'll see those come out more fully in the platform in a more general sense of what we believe to be in line with the Charter of Rights and Freedoms in Canada. And, as I said originally, the things that I've been tasked with personally is to look very clearly at the healthcare system and say, how do we affect change there? I think the questions you're asking, at least from my perspective, are more existential in nature to say, how would a Pierre Poilievre government approach this thing? And I would say those questions are better directed at Pierre Poilievre than they are at someone who's the conservative health critic.
Okay. There's other questions that our viewers that would probably want to hear. And one is transparency when it comes to the Public Health Agency of Canada. For example, 85%, roughly around that number, of the funding comes from big pharma. And when it comes to the studies that they're putting out for the public, those studies are taken by trust from big pharma instead of being done independently. Is there something the federal government will be doing to help there, maybe using more tax-funded funds to make that agency more independent?
I think when you begin to look at the terrible state of affairs that exists now, so I was able to give a speech on the SDTC scandal that's in front of Parliament right now, in understanding that what has happened in the last 9 years is that the Trudeau Liberals, in concert with the NDP, have appointed their friends to give out vast amounts of money in this country. So in this particular scandal, we've now found out that almost $400 million has actually been given to friends and companies that are run by people who make the decision of who gets the money. That's the type of lack of transparency that is absolutely unacceptable in this country. And, it's interesting. I always wondered when, before I came here to this place 3 years ago, people would talk about boards and people getting appointed to boards, and you think, wow, they don't get paid much. How do they make money? And now you understand how, under this NDP Liberal government, how they've done that. And what they have done is to pad the pockets of companies that they control, thereby increasing their wealth. For instance, Stephen Guilbeault was a lobbyist before he came to his current position as the Minister of Environment, and he lobbied the federal government 25 times in the year before he was elected for a company called Cycle Capital. Cycle Capital, in which he still owns shares, received funding from SDTC. And he refuses to tell how much his shares are worth and how many shares he owns. So when you begin to look at the scandals and the lack of transparency that exists at the current time, that is something that obviously Canadians don't want. It's an intolerable position and something that Canada's Conservatives will not tolerate.
Today, you gave a talk about a very important crisis across Canada, especially from where I report in British Columbia, which is our opioid crisis. And the leader, Pierre Poilievre, has called things like safe injection sites drug dens. He's gotten a lot of support for that type of language and a lot of pushback. What will be the answer to going a different approach from the federal government in that area?
Well, what we know is that so-called safe supply is not safe. We know that it's a palliative care approach to the treatment of addictions, in the sense that when all we do is give people the drugs that they are seeking out, their cases become worse and worse and worse. They're not being offered any treatment. And, sadly, I spoke to many people here today, in particular one gentleman whose daughter is suffering with an addiction to meth. And when you understand the plight of those parents, to say, oh, here's my daughter. And what resonated with this gentleman was the fact that not any Canadian was born, or anybody was born, to say, I would like to grow up to be a drug addict. His daughter was a straight A student. And now here she is living on the streets here in Calgary, calling her dad innumerable times that he comes from Edmonton to meet her. And the next thing we know, from his own words, that she's not answering his calls. It's a terrible affliction. And clearly we know that we need to focus on prevention. We need to focus on disruption in terms of working with law enforcement and making sure that they have the right tools to do their job. And we also need to focus on rehabilitation. And rehabilitation is a very complicated topic, in the sense that folks have been separated from their jobs and from their families, from other loved ones, and to aid them in that recovering of the life and the hope and the aspirations that they had, that I spoke about originally, that needs to be the focus of what we're doing here in Canada.
Did you know that for as low as $8 a month, you can have access to our exclusive Rebel News content, including what took place at the Rebel Live, the Ezra Levant Show, and our documentaries. To do so, you just have to go over to our website called rebelnewsplus.com and hit subscribe today.